What structure is hidden in pink? As a hint, note the artery feeding this structure. This is the acinus. It comes from the Latin word meaning kernel, and is the structural unit of the lung distal to a terminal bronchiole. It's supplied by a first-order respiratory bronchiole. It contains alveolar ducts and alveoli. It is the largest unit in which all airways participate in gas exchange and is approximately 6 to 10 millimeters in diameter. One secondary pulmonary lobule contains between 3 and 25 acini. Individual normal acini are not visible, but acinar arteries can occasionally be identified on thin section CT scans, such as a micro CT, which is seen here. This is a healthy human lung. We see two secondary pulmonary lobules with intralobular septa. MIP reconstruction in the bottom right shows acinar arterioles at the peripheral lung. Accumulation of pathologic material in acini may be seen as poorly defined nodular opacities on chest X-rays and CTs. For example, here's an adult presenting with cough and the diagnosis of pulmonary tuberculosis. This axial CT shows tree and bud nodules in the anterior segment of the right upper lobe, representing acinar filling by inflammatory cells. Centrilobular emphysema is a good example of acinar pathology as well. Here we see multiple hypodense centri-acinar opacities. In this adult with hemoptysis, we see multiple ground glass nodules, approximately 6 to 10 millimeters in size in the right lung, secondary to acinar involvement. Here is an illustration highlighting honeycomb formation. Axial CT shows circles representing normal pulmonary acini. During the evolution of pulmonary fibrosis, intralobular septal fibrosis manifests as acinar wall thickening. In a later stage, some acini eventually collapse, while others increase their dimensions. With evolution of fibrosis, those dilated acini constitute the cystic disease seen in pulmonary fibrosis. Due to such overlap of cysts and collapsed acini, we identify a paradoxical reduction of total lung volume despite the acinar dilation, i.e. cystic disease. Honeycombing findings in a CT shows final stage of evolution. Lastly, in this adult female presenting with shortness of breath and the diagnosis of nonspecific interstitial pneumonia, we see septal thickening in the range between 6 to 10 millimeters in size, illustrating its interacinar location. This is called intralobular septal thickening, in contrast to interlobular septal thickening. The incorporation of acinar lung structure into lung diagnostic imaging is very important. You now know a lot about the acinus. Please subscribe for more awesome anatomy and radiology videos.